Has someone you care about been showing quiet but worrying changes over the past year? Many people believe that death in old age comes suddenly, but the truth is, the body usually gives subtle warnings, months, sometimes even a year, before the end. These signs are often overlooked because they seem minor at first. Only in hindsight do families realize the clues were there all along. By then, it's often too late to prepare or to make those final moments truly count. In this video, we'll go over 5 key signs that can appear a year before an elderly person passes away. You may have noticed some of these already, but dismiss them as normal aging. Others might seem small, but actually reflect the body's slow decline. Recognizing these signs early allows you to give better care, create meaningful moments, and ensure your loved one's final stage is filled with comfort, dignity, and peace. Stay with us until the end. These 5 signs could help you prepare emotionally and practically for what's to come. When you understand what's happening, you won't be caught off guard, and you'll be able to make the most of the time that's left. 1. Noticeable weight loss. One of the earliest warning signs is unintentional weight loss. Maybe your loved one's clothes look looser, their belt fits differently, or they seem to eat less. Families often see this as just part of aging, but unexplained weight loss usually signals a deeper issue. It could mean the body isn't absorbing nutrients well, muscle is wasting away, or the digestive system is slowing down. Some people lose their appetite because food no longer tastes good or they feel full quickly. These aren't just preferences. They reflect how the body is beginning to shut down. Chronic illnesses like cancer, heart failure, or a kidney disease can also cause gradual weight loss before more obvious symptoms appear. Even conditions like depression or memory loss can lead to eating less. Sometimes families try to fix this by encouraging eating, offering favorite foods, or using protein shakes. But if the weight keeps dropping, it's a sign the body is preparing for a bigger change. At this point, focusing on comfort foods, hydration, and dignity matters more than pushing big meals. 2. Deep fatigue and weakness. Another major change is extreme tiredness that doesn't go away with rest. This isn't just feeling sleepy, it's exhaustion so deep that even simple tasks become too much. Getting out of bed, walking to the bathroom, or having a conversation can feel overwhelming. As the body starts shutting down, energy is conserved and physical activity becomes harder. Muscle strength fades and circulation weakens. They may sleep more, nap during the day, or seem to run out of energy suddenly. Emotionally, this can be frustrating. A once independent person may start to withdraw, not because they've given up, but because they're just too tired. For families, this change can be difficult to watch, but instead of trying to push them to do more, it's important to honor their limits and focus on making them comfortable. If your loved one is always tired and never seems to bounce back, it's a signal the body is transitioning. 3. Confusion and emotional withdrawal. Cognitive changes are another common sign. Your loved one might forget things more often, get confused in familiar places, or repeat themselves. Even if they didn't have memory issues before, this may be the start of mental decline. As oxygen and nutrients to the brain decrease, thinking becomes harder. They may struggle to make decisions, lose track of time, or fail to recognize familiar faces. You might also notice emotional withdrawal, less talking, less interest in company, or long periods of silence. It's not that they don't care anymore, their brain just can't process things the same way. Their mood may shift too. Some people become irritable or anxious, others seem strangely calm or detached. These changes aren't intentional. They're the result of the brain adjusting to the body's decline. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer comfort, and simply be present. Even if they don't respond, your presence still matters. 4. Frequent infections and slow healing. As the immune system weakens, your loved one may start getting sick more often. Minor infections like UTIs, colds, or even skin wounds take longer to heal or keep coming back. This happens because the body can no longer fight or recover like it used to. Cuts heal slowly, bruises last longer, and infections may seem mild at first but drag on. You might also notice they're more tired, confused, or not eating well. These can be signs of an infection even without a fever. The body's signals change as it weakens. At a certain point, the goal may shift from curing to comforting. Focus on keeping their body clean, hydrated, and relaxed. Sometimes these steps do more than more medicine ever could. 5. Changes in breathing and circulation. Finally, changes in breathing and circulation are among the clearest signs the body is nearing the end. You might notice shallow or irregular breathing. Sometimes there are pauses between breaths or a pattern of deep breaths followed by no breathing at all, called Cheney-Stokes breathing. Their hands, feet, or nose might feel cold. Skin may look pale, bluish, or blotchy. These are signs of poor circulation as the heart struggles to pump and blood flow is focused on vital organs. They might feel breathless even when sitting or speaking. Coughing, gurgling sounds, or needing to sit upright to breathe comfortably are also common. These changes may look scary, but they're often a natural part of the body slowing down. Comfort becomes more important than treatment. Keeping the room cool, using a humidifier, offering water, or just being there. If you're noticing these changes in a loved one, it's a chance to shift your focus. Not to fear, but to presence. Not to cure, but to care. In the end, what matters most isn't how much they can do. It's that they feel safe, supported, and loved. Don't forget to subscribe and see you soon.